becoming Mind Chief Exec was probably one of the best moments of my life outside of having my children.
Yeah. It really defined how I thought mental health care and support and thinking should be.
Are you optimistic about the government's approach to mental health at the moment?
The government are taking a huge risk. I'm seeing it in our services. I know what the whole picture looks like, and I don't envy them.
The demand for mental health services is way more than one organisation can do.
And we're coming back off the pandemic, which is, again, life-altering on a macro scale.
How are you managing the pressure on your shoulders, and how are you giving yourself time to get it off your shoulders as well?
I think I probably am that leader maybe 80% of the time. And the rest of the time, I'm basically fighting for my life.
What steps are needed to create a truly sort of mentally healthy society?
I think it's so difficult out there right now. This notion of leaders being able to protect our workforce from the realities of the world is a long gone era.
It sounds so obvious, like go to a community centre, join a club, like be around your friends, like do things like that is going to make such a big difference. And then we're all designing like apps for stuff.
There's a truth in all of that, and there are no buts coming. But now more than ever, we have to be in coalition with each other.
Now then, in today's episode, I have a chat with Dr Sarah Hughes. Sarah's the Chief Exec of Mind. Sarah's a social worker turned charity CEO of one of the most well-known charities in the UK. In this episode, we talk about that journey. We talk about whether tech is a positive or negative or neutral thing for people's mental health. We talk about the macro sort of situation of mental health in the UK. We talk about Sarah's thinking on feminist leadership principles, carving out the time to ensure your own well-being in a high-pressure role. And we also talk about why Sarah will never take up jogging for her own well-being. So grab a brew, enjoy the conversation. See you in a bit.
Sarah, thank you so much for coming on to Causes.
Oh, I'm very excited to be here. Nice to talk to you.
Nice to talk to you too. So when I was doing some research, it said, so you were 18 years old when you joined the charity sector as a social worker at your local Mind in London. And then, I can't remember the date of this article, but basically, you are now the Chief Exec of Mind, overseeing 108 local member organisations. It's a huge organisation. There was a quote in there that said, becoming Mind Chief Exec was probably one of the best moments of my life outside of having my children.
Yeah, it's true.
So I guess the question that I've got is, just give me an introduction to who you are and what we sort of need to know about your story that's taken you to where you are now.
Oh, my Lord, that's a great question, but one we could be here talking till Sunday. But let me just, I think I am somebody who is mental health through and through. So I've grown up with, a family like most of us with, people in it who had, mental health challenges, addiction, all sorts of things. And thankfully from a family who had huge amounts of empathy and love and compassion. My parents were, my mum's still alive, my dad isn't, but very community orientated. So, my mum was a home help, my dad was a community activist. And so all of that conspired to create, I think, the conditions for me to want to work in the space of social justice. And then when the choice for me was go to university and do archaeology or to do social work. So obviously that was the kind of moment, the defining moment, the choice, the tipping point. And I made the choice to do social work training because I felt completely attuned with the values that I understood it to be about, which is anti-discrimination, engagement, lived experience, all of those things. And so that's what happened. And then I found Mind. And when I found Mind, and it was my first job. I actually got my first job in mental health when I was 15. So, but when I found Mind and I was 18, it really defined how I thought mental health care and support and thinking should be. And it felt like coming home.
What was it like? How can you describe the characteristics where you felt like that?
Well, it's hard to. We always talk at Mind about, what is our recipe? What is the thing that keeps us engaged? Quite a lot of the workforce are engaged for long periods of time, decades. We are a community of people who think in very like-minded ways, and it's something about the way in which we think about mental health. So we think about mental health completely aligned with physical health. There's no judgment, there's no separation of the two. There is a real understanding about the need for compassion and care, but there is also this deep belief that mental illness doesn't mean your life is over, that people can live thriving lives with even the most serious mental illness. We've just got to make it happen. And it's that core fundamental belief that keeps me part of that kind of Mind. That's our mindset. So now cut that out. That's terrible mindset. I've never.
I know it must come up a lot though. That must come up a lot.
Yeah,
so,
it does.
Before we get into, I want to talk about Mind, and I want to talk about the sort of macro stats of mental health in the UK to sort of set the context of everything. But before we get there, can you talk about? Yeah, I want to, because I read this earlier about archaeology. Like they're very different, paths. What is it about archaeology that was interesting? Do you still have some level of engagement in archaeology?
Oh yeah, I love the classics, right? So I did classics A level. I got a B as well, which is quite good for classics A level. And I love and I still do, the kind of mythology. I also love finding treasure. And actually, that notion of finding treasure is very much the way I think about this work now. So the idea of finding things out, I think is really a running theme. And I also always had this fantasy of being a sort of like, global traveller roaming around the world, which has never quite happened. Maybe in retirement. I'm nearer retiring now than I am that 18-year-old, so you never know.
Amazing. So yeah, talk to me about, before we get into Mind, obviously it's a very well-known organisation, but just give us the context of sort of what's happening in the UK, like with recent stats. What are the sort of macro stats that people need to know around mental health in the UK?
So we definitely know that there is an increase in prevalence of people experiencing depression and anxiety. So the numbers of people have just absolutely toppled. So that we used to very much talk about 1 in 4. We're probably talking about 1 in 3 now, really, in terms of that diagnosis and need for treatment. We've also got, children, young people, the prevalence is astonishing. So pre-pandemic in 2019, it was 1 in 9 children, and now it is 1 in 5 children. That is an astonishing decline in their mental health. We also are seeing all sorts of things too, which is it's longer to get help. It takes longer to get help. So we've got 2 million people nearly on the waiting list for mental health support. And then, of course, we've got the numbers of people with the most serious mental illness, although that group isn't really increasing, it's a fairly static number. And we're talking about people who live with psychosis or bipolar. Whilst that number isn't increasing, their experience is deteriorating. So, frankly, they're not getting the services they need. We've got inpatient care that is not up to standard. People with serious mental illness at that end of the spectrum die up to 20 years before everybody else does. And that is still the case today. And it's 2025. And, that is just extraordinary.
Yeah. So talk to me about Mind and what it's here to do, what it does, and how it's taking on some of these sort of numbers.
So, gosh, I mean, Mind is a federation, and so we have Mind Central, which is the organisation I'm chief executive of. We also have a retail division of 180 charity shops. I'll come to them because they're epic. And then we've got our local minds, which are the 108 organisations around the country that provide services. So we've all got various different, we've got different roles. Mind Centrally, we undertake to run campaigns, influence policy, fundraise, make sure that mental health is up there on the agenda. Those are the things that we are primarily responsible for. We support local minds to deliver their services, but they all are independent. But we will support them in terms of, day-to-day things, how they work as an organisation, making sure that, if we've got some money, that we kind of share it out. So there's various things that we do there. Then our charity shops are, 180 mental health hubs on high roads and in villages all around the country. We have, nearly 4,000 volunteers, the majority of which have mental health challenges. So they provide this wonderful kind of retail, hard cash, because it's a charity shop, but these wonderful environments where people can volunteer, and we're a kind of open door for people to get information wherever they might be. And also just to say that our charity shops won Christmas because we were mentioned in the Gavin and Stacey finale. So in case you haven't seen that, I've said it every day for the last 2 months. I'm still not over it.
I thought you wrote a Substack about it, I think.
I did. It's now firmly in our history as a moment.
Amazing, yeah. But I mean, that did it come out of the blue? Did I remember reading that it came out of the blue?
Yeah, it did come out of the blue, and I was so. I mean, the fact that I actually picked it up first, because I just cooked Christmas dinner for a lot of people, and was lying on the sofa with a very large gin and tonic, which went everywhere when I heard it, because I sort of jumped up and threw it all over the place. But it was just thrilling, and it's those little things actually that, for our shop staff who work, so hard and are brilliant, that was just a lovely moment.
Yeah, that's very cool. So talk to me about the challenges of the sort of this model. Like, what are the unique leadership challenges that you have when there's so many moving parts to this? What are some of the unique pieces of leadership sort of challenges that you have to deal with because of the structure of Mind?
Well, I mean, federations have huge pros and cons, right? The reality is that we are, the pros are really clear that, we've got strength in numbers, there is creativity at local level, there is a huge bastion of mental health knowledge within the network that is diverse and unique. And I think that we've got lots of innovation happening because we've got all of these brilliant thinkers. So all of that is true. And I think that, I was also a local Mind chief exec for a long time. So I really understand the impact it's having in local communities. And it's not just about the services we provide, but also the role we have in influencing and, sharing information locally. So that it's really clear to me. Obviously, the pros are that it is complex, it is sprawling, it is there are all of those brilliant thinkers, and what comes with that is it takes time to work things through with people. I can't just say, as chief executive of Mind, this is how it's going to be done. Even though some days I'd probably quite like to. But the reality is it would never work. So it takes time to negotiate. In some instances, we have to really work hard at collaboration and working through the barriers around fundraising and how we make all of that fair. How, we at Mind, most people on the street don't really understand that we're a federation. And I've stopped worrying hugely about that. because, that's our problem. It's not theirs. And all we want really is people to know that Mind is a place where you can get help for your mental health. And so that's the challenge we're facing now. And of course, the financial pressure is real. And that's bringing up a new challenge, because now we're thinking about sustainability for basically 109 mental health charities and 180 charity shops. That's a big task to conceptualize. But we are doing it together because we have a new strategy, which is called Federation First, which basically forces us to come together and solve these solutions as a federation.
Right. Yeah. What have you learned about, because I guess if you were the chief exec of a local Mind and now Mind sort of central, you could probably have moved faster and in the sort of local Mind. So can you talk to me about your relationship with patients? It's an ambiguous question, but how has your relationship with patients evolved?
I'm not known for my patience, and but what I am known for is just saying it how it is. And as a result of that, people generally get the truth out of me. I'm not going to spin anything. I'm going to tell you what I think the challenges are and what we might need to do. And I think that goes a long way to bringing people along. So, these are the conditions in which we are facing some of the biggest challenges of our time. It's not about sustainability. That's not our first concern. Our first concern is the growing prevalence of mental illness and how we're going to respond to it. And as a result of that, we as a federation have to lean into the hardest questions of our time, which is about how are we structured? How do we use resources? How are we able to get as much money to the front line as we can without losing, of course, the national emphasis on policy and campaigning? And so, having that out, talking about it, sharing our because we have competing demands. And also, we've recently talked about, ultimately, where does the governance sit? Who makes these decisions? And actually, when it comes down to it, what are the decisions that Mind have to make on behalf of the Federation? And, again, talking that through, but being really clear, ultimately, we have to move quickly. This is not the time for the kind of war and peace approach that will take us through decades.
Yeah. I mean, it must be just totally... It must feel impossible at times when, we were talking about the stats earlier, the demand for mental health services is way more than one organisation can do. So it's so policy. It really it has to be policy change. So campaigning, all of that stuff is vital. But I suppose my question is, how do you approach almost an unwinnable situation based on the level of demand, and you can only do so much with the resources you've got? So are there any is there certain frameworks or thinking that you go through when it's we can only allocate so much because that's literally all we're able to do, but there's so much more that needs to be done? How do you grapple with those two things?
So I think that when you have I know, and this does sound a little bit naff, right? But when you have a clear strategy and you've identified your priorities, you do have to just keep coming back to it time and time again. And we as an organisation are having to do that right now. The pressure, the financial pressure, the demand pressure is so great that we're having to really think all the time, are we applying our resources in the best way? What are the priorities? And the thing about it now is that those priorities are changing or ramping up very quickly. So, for instance, our priorities as an organisation at the moment are, children, young people, those people from racialised communities, those people who are living in poverty, because we know the evidence is crystal clear. Those are the people where prevalence increases at the most rapid rate. And if that's the case, we need to target as much of our resource there without losing sight of the bigger picture. And so the policy argument then becomes, how are we dealing with poverty, inequity, and really understanding the needs of children and young people? So we're both providing services out there in real time, but we at Mind are saying to the government, well, if you're going to do benefits reform, this is the impact it's going to have on mental health. And we already know that if you live in poverty, you're at least 4 times more likely to experience mental illness.
Mm-hmm. Are you optimistic about Mind's work with the government? Like, are you optimistic about the government's approach to mental health at the moment?
Oh, really? I mean, I think, look, it's really hard, right? So I oscillate between they've just got in,
mm-hmm.
right? This government have just got in, and the task is huge.
Mm.
I mean, I can't imagine the depth of despair that they must feel at some of the decisions that they've got to make. There is no two ways about it. The agenda for them after 14 years of austerity is beyond comprehension. I'm seeing it in our services. I know what the whole picture looks like, and I don't envy them. And that's both in, I sit on my local integrated care board, and that's also from a physical health perspective. These decisions are the pits, right? They are absolutely the pits. And we're coming back off the pandemic, which is, again, life-altering on a macro scale, global scale. But, the reality is, this is therefore not the time to deprioritise mental health. And we can argue till the cows come home about, we've got waiting lists, or we've got ambulances, stacking up out of A&E. We've got to remember that quite a few of those people in those ambulances are people with mental illness. The public are not really, I don't think, aware of exactly what we're talking about. So when somebody is feeling suicidal, or, they've been picked up in crisis, where do they go? If they don't go to A&E and there isn't a crisis bed for them, where do they go? Nowhere, or the worst can happen. Mm-hmm. So I think we're really clear that the government are taking a huge risk. And if we just want to put the moral argument aside, okay, let's put that aside. From a growth perspective, from the government's mission perspective, to put their weight behind creating a mentally healthy society and improving services would absolutely improve the growth agenda. It would absolutely reduce the benefit bill. And we can keep going round the circles, prevention versus... we can keep doing that. And we can keep, as an organisation and as a sector, keep saying the same thing. But I'm afraid you're not going to get a different answer, because the answer's the same. And I think sometimes with new governments, they want you to bring them the innovation, the new idea, the thing that's going to crack it. Well, I'm afraid for mental health, the answers have been the same for about 20 years.
Yeah. But we'll come back onto the policy bit. One thing I'm asking everybody though is, what is good leadership to you, and what kind of leader do you aspire to be, Sarah, as a leader?
This is a really important question, and one that I think at the moment many of us in leadership are grappling with at a deep level. So I ascribe to the feminist leadership model, right? And that's very much based on the concept of inclusion, courage, being really clear and boundaried, fighting for justice, being really equity focused, reflexive, and, in terms of your own relationship with power. So I that's my aspiration, and I very much learnt my early kind of framing of that came from Audre Lorde. So I talk about her all the time. She ingrained something very much in my mind about feminist leadership. As I've grown up as a chief exec, and I've been a chief exec of charities now for 21 years, 22 years, I'm really clear that this approach is the one that suits me the most. It allows me to be authentic. It allows me to be as close to integrity as I can possibly be, with all of the moral injuries that come with, but working in public service and public life. Am I that leader every day? Probably not. I think I probably am that leader maybe 80% of the time. And the rest of the time, I'm basically fighting for my life. And I think that's the truth of it. There are, I think, really interesting challenges that are around for leadership at the moment. And I think within a context where global trust in leaders is at its worst, and that is not just political leaders, which frankly, what's happening in the UK, all of that is frightening and fair. But I was saying to somebody else, at the moment, it does feel like leadership at all levels, no matter where you are, there's a deep cynicism. And I think that has got certainly worse over the last few years. And I'm not too sure what we do about that. And that is a shared experience with colleagues.
So let's just try and unpack it a little bit. Why do you think? I mean, it's clear. It's pretty clear to me why there'd be this sort of cynicism over political leaders. But do you think that's carrying through to other
Absolutely.
areas? And what's the reason? Why do you think that?
So I think there's a number of factors, and it's such a complicated area, and we need to do some research into it because I think it's quite significant. And, talking about it with my peers, there's a couple of things. One is I think it's so difficult out there right now. This notion of leaders being able to protect our workforce from the realities of the world is a long gone era. And so there is a little bit of a disconnect between what leaders can do and what leaders think and what people think leaders can do.
Yeah.
And that is not aligned. I think there's also a tendency, I was saying to somebody earlier on today, I will make mistakes as a leader, and I will absolutely make bad decisions, not regularly, have to say, because if you do that regularly, you're probably not very good at your job, but that's a whole other question. But I think that the permission to fail for leadership has really deteriorated. And so the quest for perfect leaders becomes, is increasing every day. And of course, then when we've got leaders around the world that are doing the most outrageous things, you're almost guilty by association. Just having the title of chief exec, equals you're a chief exec, mind, body, and soul. And of course, I say to people sometimes, I've been a chief exec of a charity for all this time, and I've worked in charities all of my adult life. I don't live on an estate with sheep or chickens. I live in a terraced house with my family. I don't have a drive. This fantasy about what leadership looks and feels like in terms of privilege is also not the case for charity leaders. Mm-hmm. But all of it gets very mixed up, and that's an external reality that's creeping in. And of course, then we act it because we enact it because we're having to, especially at the moment, quite a lot of us are taking our organisations through big transformation because the money's not there.
Yeah.
So it's incredibly complicated, and I think that some of the distrust or the sense of betrayal in leadership is probably fair. Especially when we've made promises that it'll be okay, or we'll get through, or because we're not in that place.
I mean, what do you think? Do you think there's steps that charity leaders can take to sort of communicate something else here? Like, what steps do you think there are that exist to sort of help in this?
Well, I mean, one of the things that we're doing at my organisation is embarking on a year-long transformation process that's about getting people involved in the problem, getting every one of us all hands on deck approach. It's also me about, posing the dilemmas. It's what I said earlier on about being honest and saying, right, these are the things that I think will get us through. Some of you are not going to agree with this, but these are the choices we're making. Giving people the opportunity to feed in and being honest about, ultimately, this is the bottom line. And I think where I know we've gone wrong in the past, or where, I can see colleagues, is that we've kind of tried to spin a tale of, we'll do this and this will happen and it'll get better and we'll be here. And actually, I think we need to be much more open and honest. We are working in an environment that is, again, a very well used phrase at the moment, but unprecedented. Mm-hmm. And I'm talking to services around the country, a chief executive of a trust today, who is basically saying, I cannot afford to support the mental health of my locality because we have not got the money. Mm. And so I know people are going to struggle and the consequence is grave. So, with that in mind, it's got to be an all hands on deck approach. And this can't be the leaders are going to be in their office. Yeah. We're going to fix the problem and deliver it. It's what can't happen that way.
And because it's unprecedented, actually that all hands on deck sort of transparent visibility, like we're all involved. We're going to sort of talk through the decisions so that decision making is clear, but also caveating this all with, but this is an unprecedented time and we actually don't know necessarily if, we can take an educated guess on certain things, but if the results are unknown, regardless of the decisions that are made, that must be quite like that. The pressure on your and other leaders' shoulders on that is pretty high. And so, how do you grapple with the personal weight on your shoulders? How do you sort of get, how do you live when work finishes? How are you not carrying it home and being able to relax as well? So I suppose there's two questions there. One is, how are you managing the pressure on your shoulders, and how are you giving yourself time to get it off your shoulders as well?
Yeah, well, I think what's really interesting is that, I belong to a big network of peers. And one of the most important things for me has been that sense of solidarity and shared experience. So I think, knowing that is really helpful and important, and you're not alone. There is no precedent, though, for somebody who's conquered it and, riding the storm. Some people are doing well in areas, and it's just all over the place. I think in terms of, and this is part of what I think we're seeing at the moment, charity leaders don't turn off generally. So if you were asking my husband that question, he would say, she's never off duty. Mm-hmm. And I think you have to, as a leader, come to terms with that. So even when I'm on annual leave, I'm still the chief executive of Mind. And ultimately, I'm accountable for what I'm accountable for. And I and most of my colleagues take that super seriously. Yeah. So that cutoff never happens. However, when I think that you have to find peace of mind somehow during the down times. So, I've got a coach that helps me, and, I've had him for 10 years, and frankly, without him, it would be hugely worse. I've got a family. My husband, my kids, I've got far too many animals that don't care what my job is, frankly. So, I think that I've got things in my life that force me to be Sarah, the human being. And but Sarah, the chief executive, is always there. She's either there with a suit jacket on, or she's there in the shadows, and that's just the way it is.
Yeah. I mean, it's true. Had Matt, the chief executive Crisis, on, and
I love him.
He was talking about how I had to sort of prod him a little bit, like, yeah, but he said, I really struggle with this, and I don't have any time to. I'm never off. I don't have any time to do anything. And I suppose my pushback is like, is it not important? And this is the same question to you. It's like, is it not important to carve out the time from a sort of longevity of being able to do the job point of view? Of like, it isn't hobbies, isn't that time like absolutely crucial for actually being able to stay in the job long enough? So how do you view that?
I agree with you. I mean, that is absolutely true. So you can't pour from an empty bucket, right? Mm-hmm. So that is, of course, a principle that I absolutely endorse. And, it's a message I'm clear with my workforce about, absolutely, this is the expectation. And this is one of those times when do as I say, not as I do scenarios. But I think the reality is we've got a huge amount of burnout in chief execs at the moment. Mm-hmm. Chief execs are on their knees. And after a hard week, all I can pretty much do is lie on the sofa for hours on end. So, there's a truth in all of that. And there are no buts coming. But I think that it's a perennial issue that is at the moment increasingly hard. So the difference between probably now and maybe 10 years ago, also for charity leaders, is the invention of social media. Mm-hmm. So it's virtually impossible now to switch off if you're an engaged person. So I'm an engaged person. I like to look at social media, and that's part of what I will do, to cat videos. But it also means I'm constantly exposed to the external world. So I basically have to go and sit in a field. And, I'm from North London. I don't want to sit in a field. I'm sorry, I love, fields. I've got an Irish mum, lots of fields. But, I'm a city girl, so I don't want that. So there's all these things that, have made it so much more difficult. And, I'm also not going to go jogging. I'm not going to do that. And so I think you have to find your way as a chief exec, what is good for you. And you do have to prioritise it. So for me, the priority for my well-being is making sure I spend time with my children and my husband.
How, because you're in a sort of, I don't know what the word is, peculiar, I guess, position in terms of, for you to lead by example on this, you're like, you're a mental health organisation. It's really important for staff to see that, you're notorious for great internal policies of mental health of mind staff. Like I know a bunch of people who've basically copied what you're doing. So obviously you take this like incredibly importantly at as sort of workplace. I'm sure encouraging staff's well-being over everything. But
absolutely.
So but because of what you've just said, and it's a struggle to turn off and things, like what are you doing anything in terms of visibility over, like, I'm off now, I'm like how are you?
Oh yes.
Yeah.
Oh gosh, yes. Oh, absolutely. And to be fair, I the other week I'd had to go to hospital for something, and then I went to work the next day and I got told off by a load of staff. So, absolutely. And the feedback is always, Sarah, get a grip. You're getting on our nerves. And that is fine. And that, that's fine. And I can take it. I get my family will be really clear. I've got a really great, somebody who works with me, Lucy, who also will say she's on annual leave. Or if she sees me doing anything, she's like, you're on annual leave. When I went on holiday, my IT colleague turned off my access to my emails. And everybody was very clear, if we need to contact you, we'll contact you. In the end, they did need to contact me because, something went off. But nonetheless, that I think that it's a work in progress. What I have done, though, is give people permission to tell me and to help me, because I feel this responsibility and duty and love for my work, for the organisation and my job. It's also a love job. So, I'm not going, down the mines every day. But I need help, therefore, to manage, burnout.
Yeah. Let's shift gears a tiny bit. So I want to talk to you about authenticity at work. In the Substack, it says that authenticity at work is, there's privilege involved there. So I wondered if you could talk about your views on being authentic at work and sort of, just talk to me.
Yeah.
I'm going to leave it as open as that.
Look, I think being an authentic leader is definitely a prize. So if you can, put the things in place that enable you to get there, I think it's a battle worth fighting, because I think it gets you to a good place. But it isn't without its challenges, right? So, when I first started being a manager, the way I spoke, the way I looked, was all relevant. It really was. And I had to kind of find a way to surpass that. So in the early days, it involved a lot of masking, a lot of playing the game, trying to speak with an accent, trying to conform. And, it very much didn't work for me. It was really the kind of, it just didn't work. And I felt incredibly vulnerable when I tried to conform, because I knew any minute now the facade would crumble. So I've spent a long time releasing those things from the way I work. So, the pressure to speak properly. And I, very much in the early days then, and I still do it now really, is that I joke about it. I'm trying not to do that as much now, but I still do it. I'll say, if I speak on a microphone, I'll say, I sound like Cat Slater from EastEnders, and that's almost, I say that because I'm, I'm trying to head off people's thoughts about, she's from North London. I mean, just silly things that you have when you're working class and you don't speak like your colleagues effectively. And I never used to dress the same, or all sorts of things that made me feel other. It wasn't until later that I realized I have ADHD, which made me even more other, but I didn't know that for a long time. And so I think that taking risks has been challenging. And I've had situations where I've told people I'm a chief executive, and they've basically jumped out of their own skin in shock and surprise. I've had people say, you don't look like a chief exec. And you're different from a chief exec, because I don't, walk around with a kind of suit or a stern face. And so there's all sorts of things that I've tried to push against. And I think for many women, authenticity brings a lot of shame, because you're easily rejected. People have lots of preconceptions about who you might be or what you're like. Everything's loaded. People will notice, and people have noticed and made huge comments on the things that I wear. Now, I've never really heard that much said about my colleagues' dress. Certainly not Paul Farmer's, my predecessor, who I love, by the way. He wears great pullovers. But
I know him.
I love him. But nobody goes on about, what he's wearing, or nobody goes on about, what Matt Hyde is wearing or whatever. So, and I think those are the things that women still have to think about. One of my greatest friends in this space, one of the most wonderful chief execs. But, you know, she's been told, can you stop wearing floral dresses? I mean, you know, it's all of that stuff. And so for Black women, for women who are marginalised in any way, it's easy to say, just be authentic, you'll be all right. Well, no, actually, because being authentic can also bring a whole load of stuff that you won't be protected to deal with necessarily in organisations.
So I guess if you can't give the advice of sort of being authentic at work because of those reasons, like what, in that same context, like what is the advice that you would give people?
So, I mean, I wouldn't say don't be, but I would say be aware.
Mm-hmm.
And so don't confuse authenticity with this notion of bring your whole self to work. Because actually, to be authentic also means having boundaries. And so part of what I say in that blog is very much, you know, if you're going to be authentic, or if that's the type of leader you want to be, well, these are the sorts of things that you might come up against. But, you know, you can mitigate that by developing these peer relationships, knowing yourself. So Polly Neat has this wonderful know yourself, be yourself. You can only be yourself if you know yourself and know what your boundaries are, understand the risks. And so there are elements of me that I choose to keep out of my leadership. And I do that to keep me safe. And that's okay. So, you know, being authentic is actually probably another word, another couple of words is intentional and thoughtful.
Mm-hmm.
I think authentic feels a little bit of a prize that, you know, holding us to account for that is probably slightly unrealistic.
Yeah, and I like the intentional piece being like, I have decided what I'm bringing to this. Yeah. How important do you take, in the sort of mix of leadership things that you have to think about, how much of the pie, I suppose, does organisational culture get, and where do you sort of frame its importance?
Well, I would say at the moment it's a big part of the pie. And I think that any organisation worth its salt at the moment is focusing on culture for all sorts of reasons. Many are to do with the issues we've already spoke about, you know, the rising demand and the impact that that's having on our people, because our people are also people who are living in the world. So, you know, it's very hard to separate, you know, out what people's experiences are in this world from the work at the moment. So that's really hard to do. I think that it's also trying to understand how we manage burnout, how we manage our duty of care in a hybrid environment. And I was talking to, actually, I meet with our trade union on a regular basis and talking to them about that earlier on, about how do we really preserve our duty of care when we might not see somebody for weeks on end. You know, and all of that, again, having open dialogue. So I think at the moment for organisations, I don't know anyone where it's not in the top 3.
Big question, but what steps are needed to create a truly sort of mentally healthy society?
Oh, gosh. Wow. Well, a number of things. I think, firstly, I believe mental health is made in communities, right? And the evidence that supports that is huge. So I think we need to go back to communities and be building, enhancing, amplifying all the good stuff that's going on. You know, community groups, activities for children and young people, opportunities for people to volunteer, all of those things are absolutely critical. And the decimation of community, I think, is a decimation of mental health. Mm-hmm. And that you absolutely can see the trajectory there. I think that something that's a bit more kind of real time, but I think we need to face into the consequences of the pandemic. To move forward, we really need to understand what's happened. Our mental health has been forever changed as a world, and we need to really understand that. I think we need to eradicate poverty. And so all policy should be absolutely relentlessly pursuing that agenda. And I certainly wouldn't be looking at benefit caps or those sorts of things right now. Absolutely not. And I think that, there's loads of things across government approach to mental health would certainly be important. But I think we need to think about our children, young people, how we're supporting them to understand their mental health, because I do think that there is a bit of a challenge for us. We're confusing the rise in prevalence of mental illness with the way we talk about mental health. So people will say, oh, everybody thinks that they're mentally ill. No, they're just using the language around it. Don't worry about that. You need to worry about the 2 million people that are on the waiting list that haven't been seen. Mm-hmm. Don't worry about some, my 14-year-old who might be talking about, mental health. Don't worry about that just now. Worry about the kid, so don't conflate the two.
Yeah.
We do need to get more sophisticated about language, but don't get sidetracked. That's a red herring. So there's loads of things. We must keep the awareness going because it's not job done. So whilst everybody thinks they know what mental health is, our research is really clear that attitudes and behaviours are deteriorating. And that's because of all sorts of reasons, mostly when, there's cost of living crisis or whatever, attitudes harden. We've had difficult stories around mental health that means that, old tropes get cast out again. So we've got lots of things going on and services that are just not good enough and not available. So all of that and more. We could be here till tomorrow.
Yeah. Well, I'm curious about, as you said earlier, like you will be on social media, and then with what you've spoken about in terms of community and the decimation of community, I suppose I'm interested in your thoughts sort of / opinion on how is tech affecting people's mental health? Do you view it as like a net positive or a net negative or neutral? Like what? Yeah, what do you think?
I think where we stand at the moment is it's neutral tipping into negative. And the evidence that supports that is very poor. So I'm not going to bet my house on it, right? Because I think there's a lot of global factors that contribute to this. But I do think that social media has a massive role to play. So I don't believe now we can turn it off. But I do have a problem with misinformation. I do have a problem with bullying. I do have a problem with online behaviour and online harm. And so I am fully supportive of an approach that tackles that head on. Mm-hmm. I'm fully supportive of an approach that really looks at what more we can do to enable children, young people to get out of their bedrooms and into communities with friends and others. So I know that a lot of that can be delivered online as well. Because I'm a digital native. No, I'm not a digital native. I want to be one. I'm in there all the time. I want to do it, not good at it. But you know what I'm trying to say. But I really worry, and I worry that my kids can see anything, any time of day. They can hear nonsense about mental health that isn't true. I'm really worried about the radicalisation of young people. Certainly our young men, and that bothers me. So I don't know what the answer is other than how do we equip our young people to do right by themselves and right by others? How can we be good digital compatriots? How can we make sure that we deal with misinformation? But that will take collective effort, and that's the bit that makes it unsafe because it takes collective effort.
Yeah. But just before we get on, we'll get into the quick fire thing in a second. But I just really want to pull on this thread a tiny bit. I suppose I worry. You've said what worries you. have worked in various charity organisations, have from big sort of similar size to Mind to smaller ones. The internet lets us sort of take programs and services to people at scale, and we need to, because there's these huge societal problems that have numbers that are, I mean, we need to do things at scale. But then as soon as you sort of deliver a service online, like are we not sort of like it sounds so obvious, like go to a community center, join a club, like be around your friends, like do things like that is going to make such a big difference. And then we're all designing like apps for stuff.
Yeah, absolutely.
What do you think?
I mean, I'd love someone to tell me the answer, because I think it's a real dilemma.
Mm-hmm.
I think part of me really wants to turn it off and just say, right, how can we just start again? And because we've had it, it's almost like, and of course the pandemic again accelerated so much of our engagement, and therefore children have gone from, I think they wouldn't be where they are now for another 10 years had we not had the pandemic in relation to their digital lives. Mm-hmm. That is for sure. It happened so fast and so deeply. And as a result, we are not able to keep up with unpicking it or unrolling it. All I can say is that I'm just trying to listen to young people. I'm just trying to fight all those instincts and go, okay, well, what is the balance that you can achieve? And frankly, and this is the bit that I think lets us down, is that we need to give them something that gets them out of their rooms, right? And at the moment, what we're seeing is schools can't do that. They're overwhelmed. Mm-hmm. If you go to some schools, they've got wild behaviour policies, which I think should be eradicated. We've got no community resources. So what's the offer? What's the offer for kids? I can say I live in a rural town now. I don't live in North London. And I know my kids are 14 and 12. If they're not going to the cinema, there is nothing else for them to do. If they're not sporty, there is nothing else for them to do. So, we've got to give kids an offer that's better.
Yeah. Yeah. It's super interesting. It's
but it is a moral dilemma, because I agree with you. The more we do online, I mean, what would happen if we just said, we're never going to do that? We're not going to do that. We're not going to do it that way.
Yeah. But then it's really hard to see. Oh. It's almost impossible to see a route that reaches anywhere near the right amount of numbers to have any meaningful difference here.
Right,
so, exactly. It's sort of, very tricky. All right. Rapid round. Give me sort of short responses to these. We've got 4 questions / prompts for you. Biggest work mistake that you're willing to share?
A specific mistake?
However you take it. There's no rules.
Well, I mean, the mistake that I make regularly is not trusting my gut instinct. And every single time I have thought, it'll be all right, and sort of tried to quieten down my, instinct, it's gone wrong. Every single time, in big and small ways. And that can be, I should have had that conversation with that person then, or I should have made that decision then. And I went against my instinct and I listened to somebody else.
You feel like you're more, you can see those more now?
Yes. I mean, it still very much happens because I'm also quite collaborative. So I do try and listen to others. And I have to be really like, for sure. But that quieting or, of your instinct is the wrong move, because when you feel something, it's based on evidence and data. It's unconscious data, but it's data nonetheless.
Amazing. A phone company comes to you and says, Sarah, we're going to facilitate you to send a text message to everyone in the world facing a mental health challenge. You have the rules of a text message, a short character limit. So one text to those people. What are you saying?
You are not alone. It can and will get better. Call us. This is the number that will help you.
Amazing. Who's the most under the radar leader that you admire?
What a great question. I mean, I've got all of my leaders in local mind. I mean, there's a couple I could name: Lynette from Haringey, Stephen from Coventry, Helen from Birmingham. I mean, all of those. Sarah from Northamptonshire. I mean, loads, right? But one that in fact, I said to her something sort of similar this morning. Is Vicky Browning?
Who's
She
Vicky?
used to be chief exec of Vikivo, and she's now doing interim arrangements. She's interim of UK youth. And the reason I say Vicky, I don't think anybody underestimates her, to be honest. But she's very low profile. She doesn't seek the limelight. And I wonder if it's the Kivo chief execs actually as well, because Jane Ide is similar. But they both demonstrate wisdom, and that level of wisdom, and I think I've found very soothing. But they are very subtle individuals that that are very they push other people forward. Well, of course they do, because they're being the Kivo chief execs, but they do that very well.
What is it? Well, like how does the wisdom show itself?
Well, actually, they both do it in different ways. So, Vicky, she uses humour. She has got an absolute ruthless sense of humour, which, I mean, I tell you, she can cut all of the nonsense out and just get to the nub of the problem. She often uses humour, which really suits me. And I think she's got a lot of knowledge, and she's calm, and she's got experience. And Jane, I mean, I was reading her. She sends a message every Monday morning to her members. And for the last, I'd say, few months, I make sure that I read those emails. And I read them because they're always full of solidarity, understanding, non-judgment, a bit of wisdom thrown in, like, you might want to think about this. And I'm here and I'm alongside you and I'm listening. And I'm like, okay, thanks, Jane. I'll carry on with my day now. Thanks.
Amazing.
And it's that sort of, I just think that those things make a difference. And there's, massively big, wonderful leaders out there too that, I admire on every level. Polly's Leaving Shelter, who I just think is a powerhouse. Tessie from Diana Awards. I mean, these women are epic.
Amazing. That's everything. Is there? But what I want to do for everybody is sort of have a space at the end into if there's anything on your minds that sort of hasn't come up that you want to talk about. The audience of this is people who are in the charity sector with an interest in development. Like, anything on your mind that you want to say before we wrap up?
Well, I suppose the one thing I would say is, now more than ever, we have to be in coalition with each other. Whether you're a mental health charity, a children and young people's charity, we're all in this business because we want our communities and our people to have thriving lives wherever they are on the spectrum. And I think this is really the challenge of our times, and we've got to somehow come together. And like, that could be in lobbying the government, it could be in service delivery, whatever floats your boat. I don't care, but I'm open to coalition and doing my bit and seeing if we can somehow together navigate what feels like difficult times.
Sarah, thank you so much for coming on to Causes. Yeah, really enjoyed this conversation.
I loved it. Thank you.
Awesome.
Thank you.